and welcome to Healthy Kingston, a health promotion and wellness program of the Kingston Board of Health. I'm Janet Wade, your host. First, a public health announcement. The Massachusetts Department of Public Health is reporting very high and rising levels of influenza activity across the state. Thousands of people are getting the flu during this peak season, and they've become very ill. And many are experiencing serious complications leading to increased visits to urgent care facilities, emergency rooms, and even hospitalizations. The current widespread burden of illness emphasizes the importance of taking preventative measures, especially vaccinations, to reduce severe disease and prevent individuals from becoming very ill, and also transmitting the flu to family members, people with who you work, and others in your community. The Department of Public Health urges everyone 6 months of age and older to stay up to date on their flu and COVID vaccinations. And vaccinations are especially important for people at higher risk of severe disease, including adults who are older than 65 and children between the ages of 6 months and 2 years, people with chronic respiratory conditions or heart disease, and individuals who are immunocompromised, and people who are pregnant. In Massachusetts, vaccines are covered by insurance and are available at no cost for almost all adults. All vaccines for individuals younger than 18 years are supplied free of charge to healthcare providers through the State of Universal Childhood Immunization Program. Tragically, influenza has already been reported to be associated with the deaths of now up to 5 pediatric patients in the state and up to 29 adults who have died so far. While COVID-19 and RSV currently remain low, the cases are gradually starting to rise again. For those who begin to experience flu-like symptoms, they include high fever, chills, muscle aches, headache, extreme fatigue, cough, sore throat, and congestion. Antiviral medications such as Tamiflu are available by prescription, and when they're started early, these medications can significantly reduce the severity of the illness. And parents are encouraged to seek medical advice promptly if they find that their children are experiencing these symptoms, and to seek help through their healthcare provider. Spending time indoors and with large groups of people increase the likelihood of exposure to respiratory viruses, and the following everyday measures are helpful in preventing the illness. Stay up to date, again, on your flu and COVID-19 vaccinations. Wash your hands frequently with soap and water. Stay home when you're sick. Cover coughs and sneezes, and consider wearing a mask in crowded indoor settings, especially if you or a loved one are at a higher risk of getting the disease. Now I'd like to introduce our guest for this program, Dr. Christine Saba, who is a nurse practitioner and doctorally prepared nurse. And I've asked her to come and speak with us about when to seek care. Urgent care versus emergency room. That discussion comes up a lot, particularly now that, again, as I earlier was talking about, people having the flu versus COVID symptoms versus other respiratory problems. When exactly to go to which provider? So, Christine, Dr. Saba, thank you very much for being here.
Hi, Janet. Thanks for having me.
Absolutely.
Glad to be here.
Always nice to have a fellow colleague here.
Thank you.
First off, what is urgent care?
Urgent care is for non-life-threatening situations. Things like cold, the flu, we're seeing a great deal of upper respiratory infections. People visit urgent care for a number of reasons, sore throat, ear pain. And, you know, if you're experiencing a symptom and you're not able to see your PCP in a timely manner, I think urgent care is appropriate. Urgent care is not appropriate for a life-threatening emergency, such as chest pain, stroke symptoms, difficulty breathing, a severe burn, fractures. Emergency rooms really should be utilized for life-threatening emergencies. People should not hesitate to seek care in the emergency room for those situations. They should definitely call 911 and present themselves to the emergency room.
Okay. Generally, when should people seek care or think about seeking care?
Yeah, that's a good question. I think patients who are, feeling unwell, they're having new symptoms. If they, their first stop really should be their PCP, who knows them best. Staff in the office can help patients, sort of talk about their symptoms and make a plan. Of course, this is outside of a situation that's a life-threatening emergency. Maybe you've had a stomach ache for a couple of days or a sore throat. Some PCPs will be able to see you, on a more urgent basis, perhaps limited or another provider in the office. But the PCP office can help patients sort of make that decision, of seeking care. Patients really should seek care when they have tried, a conservative measure such as an over-the-counter, Tylenol or Motrin, and they're not feeling well. They really should be seen or contact their PCP.
Okay. But to start with conservative measures, because there are a number of people who abuse urgent care who don't necessarily need to be there in the first place if they take the cautious measures at the beginning.
Yeah. And I think, we both know that patients know themselves the best, right? They know their body, they know their own history, they know their symptoms. Definitely trust your gut, trust your instinct if something doesn't feel, right. If what you usually do for a sore throat, tea with honey as an example, isn't helping, or if it's getting progressively worse, you know yourself the best. You should really contact your PCP, present to urgent care or to the emergency room if it's indicated, if it's a life-threatening emergency.
Okay. I know we were talking about this earlier, and you had mentioned being prepared for an urgent care visit. Could you speak to that?
Sure. Many PCP practices today are affiliated either with their own urgent care or, a hospital system that has urgent care. Not all urgent care locations will have access to your medical record. So if you're traveling or in a town that's, not where you normally receive care or not affiliated with where you receive care, it's very helpful if you, are prepared with your own history. You have a history of, your medical conditions. Medications are key for the provider to know, as well as allergies. If you're going to get prescribed something, it's very important to know that. So, and I find it helpful when patients, present and they have a good history of what's been going on most recently, when their symptoms started. What have they tried? What's making their symptom better? What's making their symptom worse? And what they're concerned about. I think those are ways to be prepared for an urgent care visit.
What about calling ahead?
So many places will make an appointment for you for urgent care, which is different than the emergency room. As we all know, you present to the emergency room and it's triaged by level of emergency. So it's possible, depending on your complaint, that you may be waiting for a while.
Right.
But most urgent care clinics will accept appointments. They do have walk-in appointments available. Again, you're going to be seen in the order in which is determined, and that really helps make it much more streamlined for patients and families. It helps to make the system run much better for you in an urgent care setting. For most patients, they will find urgent care visits to be a bit more cost-effective than going to the emergency room, although that should not be the determining reason as to why you go to an emergency room versus urgent care. But For most insurers, urgent cares are a little bit less expensive than the emergency room.
Can you speak to that?
So it really depends on your insurance coverage. Some insurers have an actual urgent care copay that it's a little bit different than what you would normally pay for a PCP or a specialist. But it may not be as much as a large out-of-pocket cost for the emergency room. So it's much more cost-effective for the patient.
Right.
And as I said, their care might be a little bit more streamlined in the urgent care setting, as long as it's an appropriate presentation.
I know if you could speak a little bit more to emergency rooms. I know I've certainly heard quite a bit that the emergency rooms are backed up, they're overextended, the wait there can be very challenging.
It's very challenging. It's challenging for patients, it's challenging for families, and it's really challenging for the staff. In a normal day of car accidents and unexpected emergencies and heart attack and strokes, now we have layered in there just an abundance of respiratory infections, and patients are really sick. There's just countless emergencies that are presenting to the emergency room, so they can only move as quickly as they can move depending on the emergency. So, patients unfortunately are waiting not only to be seen, but once you're seen, you're waiting for test results, of course, you're waiting to be seen by a provider. And then the determination if you're going to be admitted. Unfortunately, right now, bed capacity is a challenge at many of our hospitals. So patients have come to realize that they may be waiting for quite a period of time to get an actual hospital bed.
Right.
Some emergency rooms have observation units where patients will be placed there for a short period of time to observe them, to make a more streamlined decision about their need for admission. Not every hospital has that capability, but it's also a way to kind of decompress the emergency room so that we can continue to see more emergent cases in the emergency room itself.
Okay. One other tidbit which I thought was interesting was the calling ahead to urgent care, but also finding out if they have X-ray facilities.
Not all urgent cares are created equal. Some urgent cares have the ability to do blood work. Some urgent cares have the ability to do plain X-rays. And some urgent cares that are affiliated with larger healthcare systems have the ability to perform advanced imaging, such as a CAT scan or an MRI. And it really does depend on the urgent care itself. So definitely recommend calling ahead to try to understand what services are available at the urgent care. If you happen to be out of an area that you're normally used to seeking care, you might want to make sure that they also accept your insurance to make sure that is covered under your insurance as well.
Good tips, that's for sure. What about community health clinics? I know they are throughout Massachusetts.
They are scattered throughout community health centers, and some, but not all, may be able to see you on a more urgent basis. Again, that would be a situation where you'd want to call ahead and determine, what their availability is. But there are wonderful resources just for, regular medical care to help patients manage chronic medical conditions. They offer a wide variety of services, very cost-effective services, and they're located right in the community. So they're definitely a resource for information.
Mm-hmm. Okay, we've talked a lot about urgent care versus PCP versus emergency room and then community health clinics. I'd like to talk a little bit about patients' rights when they go. What are they entitled to as far as care goes?
Well, patients are, of course, entitled to be seen, by a provider. In many situations, both in the emergency room and the urgent care setting, you are likely to see either a physician or a physician's assistant or a nurse practitioner that is trained in these various areas. You can expect a reasonable exam, of course, depending on your complaint. As an example, if you are coming to urgent care and you have a complaint that requires, an internal exam, such as a urinary tract infection or another sort of complaint, if you are not, comfortable with the provider that you are seeing, you of course have the right to decline, any sort of an exam that you feel uncomfortable with. I always encourage patients to ask for a chaperone if they're feeling, uncomfortable, or if that's something that provides some support to them. They always have the right to ask for that. But patients definitely have the right to decline, any sort of an exam that they feel uncomfortable with. And they should be comfortable having that conversation with the team that's caring for them. And to come up with a plan for them.
Right. Okay. I know it always helps if, I've told people who might be a bit uncomfortable about or getting nervous going to see a health provider, bring someone with you who can help to advocate for you, ask questions, but also hear what the provider has to say if you're nervous and you may not retain a lot of information. That's certainly always helpful.
I think that's really important, especially patients who are going to see a specialist or even their own physician and review some test results. And perhaps, the test results may not, be what they were hoping for. And it can be so overwhelming. There's so much information that's coming at you. Sure. I certainly encourage patients to take notes, but I think it's really helpful to have that second person in the room to not only listen, but to take some notes and then to maybe have some questions prepared to ask. Because oftentimes in that moment when you're faced with that situation, you may not be able to remember, some important questions that you had really wanted to ask. Right. So, thinking about that ahead of time and being prepared, but definitely having, a second person in there that's, a trusted friend or relative to help advocate for you during that visit. It's a lot of information to process, and if you're if you're someone who has delivered bad news to patients, you can sometimes see that patients almost get to a point where they've stopped listening because they just can't process the information and they're overwhelmed.
Yeah, absolutely. And particularly if they've got to make decisions about their care.
Right.
It would help to have somebody there.
Yes.
Yeah. So that, particularly in this day and age, it's important you be part of your care. You're part of the care team.
Absolutely.
And advocating for yourself, asking plenty of questions, and making sure they're answered before you leave.
And as we discussed earlier, patients know themselves the best, right? I mean, they know their body, they know when something's not right, and they know their symptoms, and they know how they generally feel. That sixth sense, that gut, they should always follow that. And, if you're not satisfied, if you seek care and you're not satisfied, you should continue to pursue that, until you have satisfaction that, it has been addressed fully to your satisfaction.
Any other health protocols or information that you'd like to relate to the general public?
I think in this sort of respiratory tsunami that we're in, and a lot of time spent indoors. It's very, very cold outside. We're getting some snowstorms. Try to avoid people that are obviously sick. I can't ask people or beg them to wash their hands enough. Wearing a mask was, something that was pretty commonplace during the pandemic, and some of those habits have kind of fallen by the wayside. But I think if you're not feeling well, or if you're recovering from an illness, I think wearing a mask when you're going to be, amongst a lot of people in the supermarket or going to, various services, I think that's very reasonable. It's definitely not too late to get vaccinated. I heard you talking earlier. Yes. I ask everybody that I see, when I work, please, once you're feeling better, please consider getting vaccinated. Lots of patients that I've spoken to have also gotten used to purchasing home test kits for COVID and the flu. And I think that's also very, wise and reasonable if you're starting to experience some symptoms. And if you continue to be sick, of course, you should seek care. Rest, hydrate, try to get outside to get some fresh air. Today when we're taping, it happens to be 40 degrees outside. I have my windows open to try to exchange the air a little bit. So trying to get some fresh air, just some of those really basic things, eating some healthy food and just trying your best, what you can to stay healthy.
Okay. Thank you so much. All excellent advice that we all need to take. And please, if you haven't gotten your flu shot, please get your flu shot, particularly 6 months of age to 2 years of age, over the age of 65, immunely compromised, any respiratory diseases in the family. Keep in mind, it's not only your health, it's the health of those you live with. Circulate with people in your community. Okay, so with that, take care, stay happy, stay healthy. And thanks again, Christine.
Thank you for having me.